We just heard on the news that a company is buying our insurance company. Will that affect us? I've had this question this year a surprising amount of times. There were two companies, I think, that were actually going through with this, one rather large one and one small one. I get this question just about every year when something like this shows up in the news. I just seem to have gotten more of it this year. The short answer is probably not. One insurance company buying another. First of all, the insurance contracts are still contracts, and part of the purchase agreements is one company has to pretty much honor the agreements of another company, except in exceptional circumstances. Company A purchasing Company B is definitely not an exceptional circumstance, or certainly not exceptional enough that state insurance departments and federal healthcare agencies would consider, making exceptions as a result of one company buying another. There are some things that could affect you in the future. Your short-term issues, though, are probably not going to be there. So if there actually is something that needs to be done, there's going to be plenty of time for some kind of change, if one even needs to happen. But a lot of times it's just one of those things. Companies are going to get bought, companies are going to get sold. As long as the company doesn't go out of business, you're probably not looking at any sort of significant issue. Things that could change. If you have a plan that's networked, probably the most significant thing that's going to happen is that your network may change. Usually it actually means, though, that the network is going to get better. Medicare supplement people, they don't have anything to worry about there because a Medicare supplement is not is a non-network plan. Medicare Advantage, though, is typically networked. Prescription drug plans are networked. You could go from a standard network, if it's a pharmacy, to a preferred network, which would mean it would get better. It could go from a preferred network to a standard, which means it could get worse. But usually it's not too significant an issue. It can be, but generally it's not too significant. Doctors may shuffle around. But a doctor can come and go from a network as they please. If it's Medicare Advantage, you can't. Medicare Advantage plans, you're stuck in it until October to December of each year for an effective date of January 1st. But your doctor, however, can leave a plan in the middle of March if they so choose. Theoretically, if a plan were to drop its were to get sold and the network moved to a different network system, theoretically a doctor could drop it. There is a danger of that. But frankly, you face that danger no matter what. A doctor can drop a network at any time and for whatever reason they want. That's one of their things. That's a perk of the system that we operate under, is that a doctor can choose and not choose to take whatever insurance they want to take. That is kind of a big. That can be a thing. The price could change. Typically, the price isn't going to go up too spectacularly. I know insurance premiums take a hit, especially in the news, and everybody has a story, including me, of how an insurance company X happened, and then it translated somehow in your mind to Y, where the insurance took some sort of significant increase. I gotta tell you, and the reality is, every time I have met with anybody at any insurance company, including, frankly, in one particular case, an insurance company I do not like, in almost any case, whenever the subject comes up of how to price a plan, I have not run into any insurance company that has ever said anything except they try to price their insurance as competitively as possible. Competitive generally means they want to price their insurance as low as they can because if they do not price their insurance as low as they can reasonably afford to price it, they know people will not take it. So by one company buying another company, they're not going to, just out of spite to you, raise the price. They are buying this company because they think your business and the entire block of business that you represent has a value to them. And so they want to keep those prices as competitive as possible. The price could go up, but the price is going to go up even if that company isn't sold. The price is going to go up regardless. That's unfortunately the nature of inflation. The guy manning the desk at the home office wants their pay raised the same as everyone else. The doctor who needs to file a claim is going to eventually have to raise his prices to the insurance company because he's got expenses. These prices will go up. Just because one insurance company bought another insurance company and now your price goes up doesn't mean it's a result of that insurance company taking a rate increase. That insurance company being bought, it's going to go up no matter what. So I mean, that's the next thing, and not to put too fine a point on it, but prices do go up on insurance. There are certain types of insurances where the price is actually fixed and you can reasonably expect it not to go up. The type of insurance that I'm talking about in these videos, any kind of health insurance, that's not one of those types. The price will go up. I can't say that too many times. The price will go up on insurance. So be prepared for that. And it is not going to matter if the company has been bought or stays under the same hands for the past 30 years. Other ways, so I mean, the network is one way that things can change. Price is going to change, but that's not really something that's going to change too much. Based on one ownership over another. The benefits, depending on the insurance, the benefits may change, usually for the better. If it's a Medicare supplement, if one Medicare supplement carrier buys another Medicare supplement carrier, the benefits can't change. The benefits are fixed by federal law. The perks that go along with them, some of them offer gym memberships, one or two have like an eyeglass benefit. I think every now and then there's one plan that has a dental benefit, but those are pretty fleeting. The perks on a Medicare supplement may change as a result of it, usually again for the better, sometimes for the worse, but almost always for the better. But if it's another kind of insurance, supplementary insurance, generally those benefits are going to change just a little bit. There's not too much fluctuation in them anyway. Medicare Advantage may see a noticeable change in benefits after a year. Generally, the plans, when you get them in October, they're generally approved around July or August. So that the insurance companies have time to actually get stuff printed and get stuff ready to go out. And yes, they still have to print. I know things can be done electronically. There's still required to be paper that goes out, and paper takes a lot of time, especially with the quantity of both papers and people that need those papers. So paper takes a lot of time. There may be 1 or 2 years down the line, your Medicare Advantage plan may have some noticeable changes. Not too many changes. I mean, there are a set of basic benefits that every Medicare Advantage plan still has to hit, and a certain kind of charge that a Medicare Advantage still has to pay on your behalf if you're their policyholder. So that part, there's probably a little more flexibility there, where they may change a little bit as a result of one company buying another. But overall, I mean, the stuff you want them to cover, your doctor visits, your hospital visits, a physical therapy, when you get when you have a heart attack, get cancer, things like that. Prescription coverage, you need that covered. All of that stuff is still going to be there. The dollar amount, the coverage amount might change a little bit as a result of one company owning it instead of another company. if you're our client, when we talk to you each year during the Medicare annual enrollment period, that's the time we're going to talk to you about making those changes anyway, but it's not going to be a mid-year change. In the middle of the year, if say in the middle of June, Company A gets bought by Company B, the month of July, the insurance is not allowed to make any kind of change like that on you. Medicare Advantage goes from January to December with an opportunity to change the plan in October. So I wouldn't stress too much about that. Basically, the question is, if your insurance company is getting bought out, it means that there's going to be a different name on the top of your envelope. Maybe one or two other changes might happen. You might get a new card. You might have a new phone number to call if you have problems. Call us, of course, if you're our client, but if you want to call the company directly, or if you need to call the company directly, that number may change. Their admin offices may change, but the functional stuff, the stuff you care about for the insurance, the stuff that makes insurance, that's not going to change. And if it's a networked plan and the network changes as a result, that network change is going to happen gradually. It's not going to be an overnight thing, most likely. So I do not expect that in the middle of the year you're going to find that your doctors are suddenly no longer covered. It's generally something, when it does happen, you'll have plenty of notice, and that's when you call your broker or whoever you deal with insurance and say, hey, this plan is no longer suitable for me. What can we do to fix this so that I can go back and see the doctors I want to get to? That's why some of us have jobs. And that's the sort of thing that we're here to help you on. But when a company changes, the key is don't panic. Keep paying your premium. Keep the insurance in force. Everything continues to work the way it's supposed to work until you get some kind of a notice that says it actually will not, and that notice will be specifically designed to go out to you. It's not going to be something that you're going to see on the news.